Hi guys, it's Tip of the Week Tuesday, and I'm here today to talk to you about birth trauma. Some people might ask, how in the world can such a wonderful experience cause any sort of trauma? Well, Andy Kolber, who is a licensed family therapist and the author of Try Softer, defines trauma as anything that overwhelms a person's nervous system and ability to cope. In her book, she explains that what actually happened in the event is not as important as how a person experiences the event. So birth has the propensity to be a really positive, wonderful, exciting experience, or it might be recorded as something that was hard, something that was fearful, something that caused anxiety or pain. And if a person's system isn't able to metabolize this stress, it gets locked into your internal system and can come back later on as a present experience rather than something you observe as having happened in the past. Our bodies tend to remember what's happened to us, whether good or bad, and it sends us signals to let us know if there's something there that still needs to be dealt with. If your birth went perfectly and you had no issues at all and everything was wonderful, you may have a hard time understanding this. But moms who have experienced trauma might look back on their birth with sadness, disappointment, frustration, pain, grief, sorrow, and they may look forward about having new births with anxiety and fear. It might even cause physical sensations, such as a fluttering heart, or butterflies in her stomach, or even cause her to be tense in different parts of her body, or to respond inappropriately in situations that otherwise would be a normal everyday occurrence. Those who have experienced birth trauma can be triggered by other people's stories, by flashbacks, by thoughts and anticipation about an upcoming birth. And this can cause physical sensations that can even lead to panic attacks and anxiety that can cause lack of sleep, that can interfere with your activities of daily living, and can even resemble different parts of post-traumatic stress disorder. Trauma could be caused by something as simple as labor was a lot harder than what you anticipated. Contractions were stronger than you were mentally prepared for. It could be that it lasted a lot longer and you went multiple days without sleep. That might overwhelm your ability to cope. Maybe it was a doctor that pushed their methods and their interventions on you despite your will. Or maybe you were even violated in one way or another. Any of those could cause trauma. Other things might be a hard delivery, a nurse that was unkind, a midwife that didn't listen to you when you asked her to stop. It could even be your baby having a hard time breathing when he or she first arrived, or maybe a transfer to the NICU. All of those things can overwhelm our senses and our ability to cope in the moment. So if you found yourself dealing with a traumatic birth and looking toward another one with anxiety and fear, what can you do about it? Well, the first thing I would encourage you to do is to take some time to do a body scan. We talked about that a few weeks ago. Take a minute, go down through your body, see if there's any place that you can recognize tension or fear or fluttery butterflies or a palpitating heart or twisted up intestines, and tune into that. But tune into it from an observer standpoint, not as the experiencer. Take a minute to name it. I have butterflies in my stomach. My gut's all twisted up. My shoulders are tense. I have a headache. Name it for what it is. Then see if you can tie it to an emotion. Was it fear? Was it anxiety? Was it the unknown? Was it a concern? Was it pain, physical, mental, or emotional? And name that emotion. If you start to name them, then you can begin to tame them. As you begin to recognize the experience that you had for what it was as trauma, and to name the emotions associated with it, take the posture of a close friend. What would you say to your girlfriend if she was experiencing those emotions? More than likely, you wouldn't shame her. You're not going to tell her to suck it up and get over it. You're going to validate her experience and show her compassion. So you might be afraid to share that with anyone else. And if you are, then take the first step to show yourself a little compassion. Talk to yourself like you're another friend in the room. I'm sorry you were afraid. It was so hard when the doctor said that to you. I can't believe the midwife treated you that way. I'm sorry. That must have hurt. Your child, you loved them so much, and you were so afraid they were not going to make it. I care that you carried that concern. I care that that was heavy and a burden. I care that you were treated that way. If you take some time to speak yourself in this way, you are validating your experience. Your body starts to respond. You might cry. It's okay. Tears actually release cortisol from our systems. You might feel panicky. And if your breath starts coming rapidly, take a minute, stop what you're doing, and find a place to ground in the room. A picture, look out the window, feel the carpet under your feet, or simply squeeze your fingers together to bring you back to the present moment. As you begin to name your trauma for what it is, to process through the emotions, and to show yourself some compassion, you will find exorbitant growth in your ability to look forward to your next birth with joy and anticipation. And in the meantime, if you're really struggling with a traumatic event, I encourage you to talk to a friend and even go talk to a licensed therapist, because they are trained in the ability to help you ground and to work through and process through those emotions. I am not a trained therapist. This is just from my own experience. My husband dealt with PTSD a year and a half ago, and so we went through counseling and have worked through a lot of trauma ourselves. So anyway, I hope this helps, and blessings on you and your birth to come.